What's trickier, shutting everything down in a pandemic or trying to open everything back up? We'll convene a roundtable of Michigan's congressional representatives. And at a time when hospitals are so critically important, how can there be layoffs and financial losses? We'll talk with the head of the Beaumont Hospital System. Today is Sunday, May 3rd, 2020, and this is Flashpoint. Hi, welcome to Flashpoint. I hope you were well this morning. It's always a good hope, but is there any better wish for anyone right now than just hoping that you're well? We've arrived at the month of May, and I hope this month isn't quite the tedious blur that April was, and most of March before that, I should mention. But now we start to look for ways to step out of our very unnatural hibernation. How do we do that? Well, clearly not in unanimity. Protesters surrounded the state capitol again on Thursday, some of them eager to display their right to bear arms, which led to some unease among lawmakers inside. But the fight between the governor and Republican leadership sheds light on the debate between opening too slowly and opening too quickly. And at the federal level, how much more help is the American workforce going to need? What can be done right now to prepare for either phase 2, the rest of phase 1, or something we don't even know about that's headed our way? This morning, a cross-section of the Southeast Michigan Congressional delegation will join me to talk about it. And a little later on, did you have any idea that our hospital systems were so reliant on elective procedures? With hospitals so important just now, how can we be looking at layoffs in the healthcare system? We'll talk it over with John Fox, the president and CEO of Beaumont Health. It's all today on Flashpoint. All right, let's start this morning by convening a conversation with 4 of Michigan's representatives to Congress. I am so glad they could all join me today from their various locations. We have with us from the 7th District, Republican Tim Walberg, you see in the upper left of the quadrant there. Republican from the 10th District, as we move to the right, Paul Mitchell. From down below Congressman Walberg, you see from District 12, Democrat Debbie Dingell. And in the lower right-hand corner of the quadrant, from the 14th District, Democrat Brenda Lawrence. Thank you all so much for being here. I really appreciate it. Congressman Walberg, let me start the conversation with you. And I'm curious your thoughts as to what you watched happen at the state capitol this past week. We've had obviously a lot of people very upset with the stay-at-home orders, but people showing up at the capitol brandishing guns, which they, I guess, are legally able to do. But to many, it was a very wild and troubling scene to some, especially to some of the lawmakers inside. I want to let you all reflect on what we saw this past week. Congressman Walberg, you first.
Well, it's good to be with you. It's good to be with my colleagues as well. I look forward to the time when we can get back and see each other daily and even on the plane flights as well. What I saw at the Capitol this week and have read about, certainly there are messy spots of being in a free society where we encourage people to voice their concerns, their ideas. And in this case, people were doing just that. Whether they did it appropriately for some people, others, I guess that's for them and others to judge. But what I've been trying to communicate to my constituents is that as we're going through this challenge that's all across the country, but here specifically in Michigan, we ought to be thinking of ways of being smart, of being safe, but remaining free. And I think that was an evidence of freedom, expressing to their leaders in Lansing their concerns. How they did it could be left to question, but the key is they did it. And I think that's something that we can all rejoice that in America and in Michigan, we can agree or disagree, but we're still free Americans. So stay safe, stay smart, and stay free.
Congresswoman Lawrence, what were your thoughts as you watched what happened?
When I saw the crowds assembling, I am one who have participated in many public displays of protest. And so I 100% respect and will protect the right to protest. However, when I saw the guns, I didn't understand the value, nor will I support the value of bringing guns into our state house and the gun part of it. And then secondly, this protest is against something to keep people alive. I don't know if these protesters are immune to the fact that people are dying. This is not a political grab. It's an opportunity to protect our community. Here in southeastern Michigan, we have witnessed the deaths of so many people I personally know, my close family friends, and it's something that it's working. And that's what's interesting. The stay-at-home executive order is working. We are actually bringing down the numbers of deaths. So I just didn't understand what their purpose was. And to say that you're free, you are free in America. You're standing there protesting. But what is the purpose of that protest?
Well, let me move up above you there to Congressman Mitchell. Congressman, your district largely made up of the Thumb area, which has not seen as many cases as we've seen in southeast Michigan. I imagine you've got some folks that sympathize with the frustrations that were being voiced. What did you think about what we saw?
Well, I've also got part of Macomb County where, in fact, there's a hot spot there in Macomb Township. So I've got both ends of the spectrum, I guess. Yeah. I think the folks toting guns into the Capitol is a distraction. It's a distraction from the issue at hand. It's unnecessary. As Tim said, and Brenda said, well, we respect anybody's right to protest. And yes, protesters can act like morons. But yes, I said that on purpose. It distracted from the issue. The issue at hand is the objective of the stay-at-home orders was to flatten the curve and to not have the healthcare system overwhelmed. While we learn more about the coronavirus, the COVID-19. Yeah. We achieved that. And now it's time to move on. We know who to protect. We know how to protect people from that are high risk. So I understand their frustration. I've expressed the same thing to the governor, obviously not while carrying an AR, that we need to move on. And I think there's ways to do that. But we need to, my opinion, she's micromanaging the economy and it's destructive. It's time to start taking constructive steps to move forward, to reopen our economy and reopen society.
Congressman Dingell, it is interesting that Gretchen Whitmer ran on her ability to kind of cross the aisle. She had to as the Senate Minority Leader. And since then, since getting into office, a lot of people have believed that she's kind of become really much more dictatorial in preferring to do things unilaterally. How would you characterize her role in all this?
You know, I think right now the American people don't want to see any partisan bickering. This has been a real threat to life in this country. I know that the governor saw some very terrifying statistics modeling from the experts and the scientists about how many deaths could have happened in Michigan and took very seriously the responsibility of trying to save those lives. So I think right now we've got to balance freedom of speech, freedom of the right to protest with what the common good is. That when I'm not quite sure why they had to have assault weapons and that people felt frightened there. But also we need to continue to physically distance as we go back to work, as Paul talks about, as we slowly reopen the economy, we need to wear masks. We need to keep that physical distance. All of the scientists and the doctors agree with that. And we got to work together to make sure that community is still safe.
I want to ask all of you what it is most that's keeping you awake at night right now, whether it is thinking about the way that our readiness looked before all of this, which obviously wasn't near strong enough for us to lead the world in cases, which is hard to believe in the most medically advanced and wealthiest country in the world, whether it's the next thing that's coming, whether it's moving too fast or too slowly. What is your biggest concern right now, Congressman Walberg, would you say, that's really nagging at you?
Well, first of all, I would question the fact that we lead the world in cases when you take per capita. You could take the next 5 countries, add them together to come up to what our population is. And you could also see that then they're way beyond us with cases. We've never done this before. I think we need to recognize that. And without putting any blame, I think we've seen both governors and the president and the administration attempting to do the absolute best they could with the knowledge they had. I mean, you cannot debate the fact that the president's team or the vice president's team is made up with people that truly know what they're talking about and are serious-minded scientists as well as medical personnel. But right now, what keeps me awake is not so much the loss of life or the sickness anymore, because I think we have really majored on that, and we have regimes in place. We have PPE that's really ramped up. We have more ventilators than we actually need right now. The hospitals aren't being surged anymore. In fact, very few of them in the state were surged here. but they pull together. But what really gets me now is the continuing economic challenge that's taking place and the long-term impact that that's going to be not only on the economies of this state and this country, but individual economies, small business people, the employees that do the services. And then ultimately, that could go on for a significant period of time, and we may then see some of the diseases, as it were, with suicide, with substance abuse, with domestic violence, with just simply the loss of hope and a dream for the future come to fruition. And that would allow me to stay up at night on many occasions.
Yeah, understandably put. Congresswoman Lawrence, what's your biggest worry right now?
My biggest worry is one of the small businesses that are they going to survive? Detroit, we've been bragging about this being a comeback city, and it's been on the back of these small businesses and entrepreneurs that have come to our city. They have only 2 to 5 years investment, and so they don't have that deep base of contingency. I worry about Detroit, and I worry about my small minority businesses. The one thing that keeps me awake is the mental health. The mental health of children who are at home saying, why can't I go visit? What's happening? The people who are losing their loved ones and not being able to grieve and go through a funeral process. As we open up the doors, there's so many people who are broken from this. The stress of going through having the disease, the virus, and wondering if you're going to live or die. I wonder about this country's mental health.
Yeah. Congressman Mitchell, what are you pouring over with your worry beads right now?
Sure. Well, I would agree with both Tim and Brenda. The long-term economic damage of this, the longer we stay at home, we basically hibernate, the worse the damage is. And it does damage families. I agree, it damages individuals, families, both in terms of their economic well-being, their mental health. The other thing that worries me is that the expectation is somehow that the federal government will be able to spend money and make it better. In total, we've put out $5 trillion between what Congress has appropriated and what the Fed has put out in terms of support for business. I want you to $5 trillion. Our national economy on an annual basis is about $22 to $23 trillion a year. And we've already put out $5 trillion trying to support it. We can't keep it afloat forever. With that, one last comment, which is hasn't been mentioned by anybody. Because we're so tied up with this, because of some of the weaknesses people are seeing, we're seeing additional issues with China and North Korea that are disconcerting, and Iran, by the way. When I return, we're supposed to get a classified briefing on that. We're going to work on the National Defense Authorization Act. But there are some concerns in terms of what they're doing over there and our readiness to deal with it. We didn't want to be in a state of weakness in terms of our nation, in terms of our focus on things, that, in fact, China does something that can be pretty provocative. And we have some issues.
And Congresswoman Dingell, what are your worries right now?
I agree with all of my colleagues, but I don't sleep at night. Didn't sleep last night. I'm worried about those that have become unemployed and whether they're going to be able to get another job. I worry about the small restaurant owners and the small businesses that don't know if their businesses are ever going to open again. I've been working very closely with the UAW, the autos and the suppliers on the need to reopen. But when you reopen, how do you keep those workers safe, particularly people with pre-existing conditions? How do we bring the supply chain back to this country so we never are dependent on foreign countries again? They were in this crisis. We have a lot of problems ahead of us, and we can't allow the peak to return. We've got to keep the number of cases down and keep people safe at the same time.
I've only got about 2 minutes left, so if everybody could be pretty quick on this last question I want to get to, and this is about unemployment. In fact, your colleague, Dan Kildee, this past week put forth a bill to expand yet another layout of money for unemployment benefits, but we have so many people, the anecdotal, what we're hearing here at the station is still so many people who cannot get through, who there's the money we know has been set aside for them, and yet the backlog has created a log jam, and so many people who need the money are being separated from it. Congressman Walberg, what can we do about that?
Get people back to work. I mean, that's what we need to do. We need to do it safely. We do need to do it smart, but we need to get this economy going again. I agree with my colleagues about the concerns that we have there, but ultimately this country does not work without working. And the best way to get the problem off the unemployment insurance system in this state and they've had problems dealing with something they've never had to deal with at this amount of applications, is get people back. I think their employers, we all listen to what Ford Motor Company has planned to do.
Yep.
Amazing stuff in trying to get their people back and do it in a safe way. A lot of businesses are doing that. It's time for our state government to say, let's take the rheostat, the dimmer switch, turn it, and get the economy going with people back to work. Then we won't have to worry about UI.
I apologize. I'm running out of time, and I really want to try and get around here really quickly. Congresswoman Lawrence.
Absolutely. We need to have a strategic plan for people to return to work safely. But in addition to that, there are some gaps in our administration that we must address. They're not functioning properly, and it's just deplorable how the Small Business Administration failed on many levels. They're working hard, but we've got to do a better job of it with structuring and having an efficient government.
Is there anything, Congressman Mitchell, that we can do logistically to get this funnel connected to where it needs to go?
I think weeks ago, they should have seen the writing on the wall. The state was slow in getting on additional help, getting additional call center, any of that. What's deplorable, Brenda, is the fact that the UI system is a tragedy. It's a train wreck. And I personally know people that have been there 6 weeks and still think they got a card, they have a check, people can't get through. The other thing we absolutely have to do, Devin, is we have to work on strategies to minimize exposure for at-risk populations, while, as Tim said, get people back to work.
And Congresswoman Dingell, you get the last word.
I'm going to be very quick. 1 million checks have gone out as of this week. The system was broken, wasn't ready for these kind of numbers.
Yeah.
I'm going to give you a very practical piece of advice. 100,000 people have had to be called back. The carriers are calling it spam. Answer your phone. You can hang up if it's not spam, but there are people that are trying to call back. And we just need to try to help everybody. Compassion, kindness matter right now.
No doubt. I'm so grateful to have all four of you with me. Thank you so much for the time. Stay safe, and we will talk to you again very soon. We come back.
Safe.
The crisis in hospitals. This is Flashpoint on Local 4.
Since the pandemic began, I am humbled at what I am witnessing. Great strength and courage and tireless commitment from our front lines. They are giving everything they have to this fight.
Thank you to our nurses, respiratory therapists, physicians, and all staff taking such special care of our patients. To the community for supporting caregivers by staying safe and staying home. And to our generous donors who are supporting our team.
I have never been more proud to be part of this organization. You are remarkable, and we humbly say thank you.
As our sales department is temporarily closed due to COVID-19, our service department is essential to your transportation needs. It's imperative that we go above and beyond for our team members and our guests to ensure that they're safe. It's not business as usual. Exercising social distancing, creating a touchless experience, constant sanitizing of waiting rooms, vehicle inventory, and customer cars are just a few steps that we're taking to create a safe environment for our guests and team members. We welcome you in our service department, and we look forward to seeing you back in the showroom. So go to saveoncars.net and book your appointment today.
It's almost Mother's Day, and this year we're honoring the moms working on the front lines during this health crisis who deserve a relaxing escape when the time is right. Last week, moms were nominated for the Live in the D Essential Moms Contest. 5 deserving moms will be rewarded with a trip for 4 to anywhere in Florida, and they'll have until the end of 2021 to take it. This week, the winners are revealed. One deserving mom will be highlighted each day on Live in the D. Go to Click on Detroit to find out more.
We've watched a double-sided crisis for many hospitals in Southeast Michigan, often overwhelmed both logistically and certainly emotionally by COVID-19, but at the same time financially savaged by the downturn in other varieties of health care, which has meant cutbacks and layoffs. Very happy to have with us John Fox, the president and CEO of Beaumont Health. John, I so appreciate your time today. I trust you're well. I want to talk to you first about this. I think the surprise that when we first heard that our hospitals were going to have to lay people off, I don't think anybody had a clue that our healthcare system was so reliant on elective procedures.
Yeah, Devin, that's exactly the case. I mean, what happened is when we needed to stop elective surgeries, which we needed to do from a public health standpoint, and dedicate so much of our system and our hospitals to COVID-19, we basically lost about 40% of our revenue. So for Beaumont Health, in just 2 weeks in March that we had COVID patients, we lost $75 million. And frankly, right now we're tracking to lose about $150 million in the month of April before you get to some of the federal money that we may be getting.
Well, and when you think, you're obviously you don't know exactly what's coming there, but can you even break even on the COVID care that you've given?
No, you really cannot. I mean, it's extremely expensive to take care of these patients. They require a lot of nursing care. We had to expand our number of ICUs by 40% and went up to about 750 critical care beds across Beaumont Health. That was very costly. The medications, the ventilators, and again, they're replacing much more higher revenue yield surgeries that we discontinued. So our surgeries dropped 80 to 90%. That was replaced by COVID-19 medical patients that were much lower revenue per patient, but not that much lower in costs.
Yeah. Yeah. I want to talk about where we are right now. You provided a graphic that I'm looking at the moment that kind of shows this initial surge, this big red area that we see on the graphic that was about the initial 2 months. We've moved into the yellow warning zone, ongoing treatment, which is sort of this new normal as it's put on the graphic. But this is sobering because that yellow zone lasts 12 to 24 months.
Right. Here in Southeast Michigan, the way I explain it to our employees and physicians and others and our board is we have gone through the initial surge, what I call the red zone, where we went from 0 to 1,200 patients in about 3 weeks at Beaumont Health. It was like nothing I've ever experienced in my 40 years in healthcare. We are now coming down from our peak of 1,200. Today, we're at about 520 inpatients, COVID-19 inpatients across Beaumont Health. We have more medical surgical patients, not COVID-19 patients, than we do COVID-19. But we're going to plateau for the next 12 to 24 months with continuing to take care of COVID-19 patients because they're going to continue to be present and frankly omnipresent throughout our community and throughout our state at some level until after a year or two we get to what we call the green zone, out of the yellow caution zone, if you will. And in the green zone, we will have an event called a vaccine. But the challenge with the vaccine is once we have one, and sooner is better than later, it needs to be produced for billions of doses and then distributed to billions of people around the world. Now, I hope Michigan and the rest of us in the United States get it as fast as we can. But this is on a size and scale that we've never seen in really healthcare, global health in the world or in the United States.
The next question I have for you is going to seem politically charged. It's certainly financially charged, but I think it's a fair time to talk about this. If we had a national or more universal healthcare system right now, wouldn't it be easier if patient records, if everything was sort of centralized rather than right now all of our disparate pieces all over the place trying to fight something like a pandemic? Is that a fair argument to make?
Well, there's no doubt that the disaggregation of American healthcare certainly didn't help us with this. We went through our own version of this in Michigan and Southeast Michigan because our ability to coordinate the giant influx of these patients between and amongst hospitals in those first 3-4 weeks was really limited. And we had to work a lot with the governor and her teams on how to get information collected and then also make sure that we were helping each other out with respect to that onslaught. And that was something of a mixed bag. Going to universal health care or that kind of a system creates a whole bunch of other political questions. But with respect to COVID-19, we have a lot of work to do if we're going to make our current system be able to function in this pandemic. And maybe more importantly, given the reality of biology, what will be future pandemics, or at least the risk of them.
The next one, exactly right. Fascinating conversation. John, we so admire what you and so many of your employees have been going through. I so appreciate you giving us some time today. Best of luck going forward. Thanks so much.
Well, thank you very much, and thank you for letting us share our story with you.
You bet. Back with more on Flashpoint right after this.
With Michigan weather being so unpredictable, spend tax returns and profit-sharing checks where it matters most, your home. Call Ace & Sons today.
Don't go to the wrong place. Leave your insulation to Ace.
In these uncertain times, we are here for you. Beaumont is leading Michigan through the COVID-19 crisis, and we will help lead the way out. Our expert doctors and caregivers have created a secure environment so you can feel safe coming to us for care. If you have life-threatening symptoms, go to one of our emergency centers. If your surgery was postponed, call your doctor. They're ready to help. I can assure you, Beaumont is safe and ready to serve you.
Recent statistics show a large percentage of Michiganders can save over $1,000 a year by refinancing. Call 248-308-5000 or chat with us online at davidhallmortgage.com.
What's the next chapter in this moment in time? In my job, I get to see how determination, love, and community are helping us make it through. The thing I've noticed is being forced apart has shown us just how much we really need each other. Simple acts that used to barely take a thought now take planning and passion. Maybe that's the silver lining in this moment in time. The one thing we can really count on is each other.
5 guests this morning who are all juggling a lot. I'm so grateful they could make time for us today. I'm so grateful for you being here as well. Hang in there. Cinco de Mayo on Tuesday, maybe a private fiesta at home. Best I could do. Stay safe and stay healthy. We'll see you next time right back here for Flashpoint.